Taking care of your health can be complicated. As you've probably experienced, most health-related issues aren't immediately cured after a single visit to the doctor's office. Usually you must nurse yourself back to health from home, and even then, additional visits to the doctor are often needed to take care of the problem for good. Luckily for us, home health treatment isn't difficult to do. Get some rest, drink plenty of water, and wash your hands is often what we're told to do. A bowl of warm soup doesn't hurt either. Here in the US, these home remedies are taken for granted, and most are considered to be simple common sense. But in other places in the world, it may not be so simple. Imagine you're not feeling well, and the closest clinic is hours away, and the only water available to you comes from a dirty creek. You know that diseases in the water will only make matters worse, but you have no choice. You must drink it. Also imagine there isn't a bathroom in your home, much less one in your neighborhood. And basic practices such as washing your hands to prevent the spread of germs have never been taught where you live. The lack of education about these ideas means the sickness spreads without reason. And so does the fear. Everyone is too afraid to care for you, and there is no one around that can make you well. So you go day after day without knowing where this reoccurring illness is coming from or how to stop it. This is the reality for many of the rural communities in Africa where Bloodwater Mission works. And one of the ways we are addressing these issues is through our community health promoters. Community health promoters are people who made the choice to combat the diseases that have consumed their homes. As a representative of their communities, they travel sometimes great distances to health facilities that provide vital education on health and sanitation that many communities in Africa lack. Equipped with disease-fighting knowledge, they go back to their communities and educate their neighbors on ways they can combat illness in their own homes. As the sickness is managed and the diseases start to fade, the community as a whole makes the connection between health and sanitation, and they are no longer afraid. The hopelessness, the stigma, the isolation are replaced by hope, knowledge, and community. They have someone who can answer their questions. They are cared for by their families. They are helped by their neighbors, and they are not alone. And the cycle continues as neighbors learn from each other and then teach the communities that surround them. The home remedies we take for granted are no longer a foreign idea to rural African communities. They become common sense. Bloodwater Mission has helped launch clinics in Africa, like the New Life Medical Center in Kitgum, Uganda, and these clinics offer programs that educate community health promoters. Your support has allowed places like the New Life Medical Center to continue to provide treatment to its patients, but you have also improved education in the area as a whole. Health is not only improving at the clinic, but around the entire region. With your financial support, the number of community health promoters will continue to grow, and more communities will have access to this life-saving knowledge and share it with others. The knowledge will spread instead of the disease. It will bring health, it will bring hope, and the fear that was so common before will never be feared again. This is what empowerment looks like. Join us and let's share the knowledge together. Give, share, empower. Bloodwater Mission.